Seniors, these are 7 essential vitamins to keep your legs strong. Picture this. You wake up each morning with legs that feel steady, powerful, and ready to move. No more nagging cramps, no more muscle fatigue, and no more worrying about losing your balance or falling. Staying active and confident as you age isn't just about exercise. What you feed your body plays a huge role. And today, we're diving into 7 key vitamins and minerals that are vital for keeping your legs strong and resilient. These nutrients do everything from boosting muscle strength to improving blood flow and maintaining healthy bones. Whether you enjoy taking long walks, dancing, or simply want to stay mobile and independent, this video is here to guide you. Make sure to stick around until the end. Vitamin number 2 is something most people have never heard of, but it's incredibly effective and could make a real difference in your leg strength. Before we jump in, I'd love to hear from you. Where are you tuning in from today? Drop a comment below, ask any questions you have, and don't forget to subscribe and turn on notifications so you never miss a health tip. Let's start. Number 7, vitamin D. As we get older, it's normal for our bodies to go through certain changes. Muscles shrink, bones become less dense, and movements that once felt easy can start to feel like a challenge. One key, and often ignored, a reason behind this decline is not getting enough vitamin D. While most people think of vitamin D as just the bone vitamin, its benefits go far beyond that. This nutrient is vital for maintaining strong, steady legs and helping you stay balanced and mobile. In fact, it's one of the most powerful tools seniors can use to keep their bodies moving with confidence. Here's the issue. As we age, our skin becomes less effective at converting sunlight into vitamin D. Add to that the fact that many older adults spend less time outside due to limited mobility, lifestyle habits, or sun exposure concerns, and the result is widespread deficiency. And that deficiency can quietly weaken your legs. Studies have shown a clear link between low vitamin D levels and reduced muscle strength, poor coordination, and more frequent falls in older adults. One study published in the Journal of Clinical Endocrinology Metabolism even found that seniors with adequate vitamin D had stronger, more responsive muscles and better balance, making them less likely to get injured. Without enough of this vitamin, your fast-twitch muscle fibers, the ones that help you react quickly and stay upright when you stumble, begin to fade. This leads to slower reflexes, weaker movements, and a higher risk of falling. But it doesn't stop at muscle control. Vitamin D also reduces inflammation in muscle tissue, which can ease common leg complaints like stiffness, cramping, and chronic pain. So, if you've been dealing with sore or tired legs, low vitamin D might be playing a role, and fixing it could bring noticeable relief. Failing to address a vitamin D deficiency doesn't just mean weak legs. It can lead to serious complications, especially when it comes to bone health. Without enough of this vitamin, your body can't properly absorb calcium, which means your bones become fragile and more prone to fractures. Even a minor fall could lead to a major break that severely impacts your independence. Beyond muscles and bones, research has also connected low vitamin D to heart issues, cognitive problems, and a weaker immune system, all of which can take a toll on overall quality of life in older age. So what can you do about it? Here are 3 key ways to boost your vitamin D and protect your legs. Get some sun. Spending 15 to 30 minutes in direct sunlight a few times per week, ideally in the early morning or late afternoon, can naturally raise your vitamin D levels. Aim to expose your arms and legs for best results, and remember, sunscreen, while important, can block vitamin D production. Add vitamin D-rich foods. While food alone may not provide all you need, including fatty fish like salmon and mackerel, sardines, egg yolks, fortified dairy, and mushrooms can help you reach healthier levels. Use supplements if needed. For those who rarely get outside, supplements are often necessary. Most experts suggest 800 to 1,000 IU per day to support muscle and bone strength. Higher doses might be required for people with significant deficiencies, but that should always be discussed with a healthcare provider. If you're unsure where your levels stand, ask your doctor about a simple blood test. Many physicians now routinely screen older adults for vitamin D, knowing how important it is for preventing falls and maintaining independence. Number 6. Calcium. When you're younger, your bones are constantly being rebuilt and replenished. But as we age, that rebuilding process slows down and bone mass begins to decline. This makes older adults more vulnerable to fractures, especially in the legs. Hip fractures, femur breaks, and stress-related injuries in the lower limbs can result from even a simple fall. What once would have been a harmless slip can now mean weeks or months of recovery, or worse, permanent loss of mobility, if your bones are lacking in calcium. But calcium isn't just important for bone health. It also plays a critical role in how your muscles work. Every time you walk, stand, or even shift in your seat, your muscles rely on calcium to contract and respond properly. Without enough calcium in the body, muscles can become weak, slow to react, or prone to cramping. That's why a deficiency often shows up as tired, heavy legs, frequent cramps, or a general lack of strength and coordination. So how can you make sure you're getting enough? Dairy is a well-known source. Things like milk, yogurt, and cheese provide a solid calcium boost. But they're not the only options. You can also get calcium from leafy greens like kale and bok choy, as well as almonds, tofu, canned sardines with bones, and plant-based milks that have been fortified. The best approach? Mix it up. Eating a variety of calcium-rich foods helps your body absorb and use the mineral more effectively. That said, food alone might not always be enough, especially if you have dietary restrictions, absorption problems, or higher calcium needs due to age. In these cases, supplements can help fill the gap. Just keep in mind, for supplements to work properly, your body also needs vitamin D, which helps with calcium absorption. Taking them together ensures better results. Still, more doesn't mean better. Taking too much calcium, especially ally in supplement form, can lead to problems like kidney stones, calcium buildup in the arteries, or digestive discomfort. That's why experts generally recommend older adults aim for 1,000 to 1,200 milliliters of calcium per day, combining food and supplements as needed. But here's something many people overlook. Calcium alone won't do much if you're not moving. Weight-bearing exercises, such as walking, light jogging, or strength training, are essential. These activities stimulate your bones to rebuild and help direct calcium right where it's needed, into your skeletal system and muscles. Without regular movement, even the best calcium intake won't fully protect your bones. If you agree that these first two vitamins are essential, go ahead and comment yes below. If you're not convinced, type no. We'd really love to hear your thoughts. Number 5. Vitamin B12. When most people think about strong legs, they usually focus on nutrients like protein or calcium. But what if we told you that one of the most important players is actually a vitamin that helps your nerves fire properly? That's where vitamin B12 comes in. This nutrient is crucial for the nervous system. It helps maintain healthy nerve function, allowing signals to travel smoothly from your brain and spinal cord down to your muscles. Without enough B12, those signals get delayed or distorted, and your legs can begin to feel heavy, sluggish, or even numb. It's no wonder that one of the first red flags of B12 deficiency is a persistent feeling of weakness or tingling in the legs. Here's what makes this especially concerning. B12 deficiency is far more common in older adults than many people realize. Unlike some other vitamins that are easily stored or found in a variety of foods, B12 relies heavily on your digestive system to be absorbed. As you age, your stomach produces less acid, and this drop, along with conditions like reflux or long-term use of antacids, can interfere with B12 absorption. Plus, many seniors don't eat enough B12-rich foods, often without even realizing it. Over time, this creates a slow, silent depletion that can do serious damage. And it's not just about fatigue or weak legs. Long-term deficiency can lead to irreversible nerve damage, affecting your ability to walk, keep your balance, and react quickly. Some older adults chalk it up to just getting old, when in fact it's a preventable issue tied to one simple nutrient. The good news? When B12 levels are restored, the results can be dramatic. Research shows that correcting a deficiency can lead to significant improvements in leg strength, energy, and coordination, sometimes within weeks. But where do you get B12? Unlike many other nutrients, B12 isn't naturally found in plant foods. It's primarily in animal products, things like eggs, dairy, lean meats, fish, and especially shellfish like clams or organ meats like liver, which are among the richest sources. For people who follow a vegetarian or vegan diet, or those with absorption issues, B12 fortified foods like cereals and plant-based milks or supplements are essential. One of the best things about B12 is that it's very safe to supplement. Your body simply gets rid of the extra through urine, so taking higher doses is often recommended, especially for seniors or those with low absorption. Some people even receive regular B12 injections under a doctor's care, which can be a game changer for maintaining mobility. Routine blood tests can also help track your B12 levels and catch deficiencies before symptoms get worse. Here's the bottom line. Strong legs don't just depend on muscle. They depend on how well your nervous system functions. Without proper nerve communication, your legs can't respond quickly or move efficiently, no matter how hard you train. That's why keeping your B12 levels in check is one of the smartest, most overlooked ways to stay mobile, confident, and independent as you get older. Number 4. Magnesium. It plays a crucial role in helping your muscles contract and relax properly. Without enough of it, muscles may tighten unexpectedly, fatigue faster, or even spasm painfully, especially at night. One of the clearest warning signs that your body might be running low on magnesium is restless leg syndrome, or those sudden sharp cramps that hit while you're trying to sleep. Magnesium acts like a calming agent for your nervous system, keeping overactive signals in check so that your muscles don't twitch, lock up, or ache unnecessarily. If you often feel tightness, stiffness, or unexplained tension in your legs, there's a good chance magnesium might be playing a role. But magnesium's job doesn't stop with muscles. It's also critical for your bone strength and joint function. While calcium usually gets the spotlight, calcium actually depends on magnesium to do its job properly. Magnesium makes sure calcium is directed into the bones, not into soft tissues like joints or blood vessels, where it can cause stiffness and even pain. Studies show that higher magnesium intake is directly linked to stronger bones and fewer fractures in older adults. That makes it a key mineral for staying mobile and active as the years go by. So why is magnesium deficiency so common? Several everyday factors can drain magnesium levels without you realizing it. Things like chronic stress, poor diet, or medications, including blood pressure drugs, diuretics, and antacids, all lower your body's magnesium stores. The result? Walking shorter distances than you used to, feeling tired after basic chores, struggling with stairs or daily movement. And while it's easy to blame this on just getting older, the truth is that a lack of magnesium might be the real reason. To get more magnesium naturally, focus on foods like spinach, almonds, black beans, pumpkin seeds, avocados, whole grains, and legumes. These are all great sources that support both muscle and bone health. But if your diet alone isn't cutting it, which is often the case, supplements can help. Magnesium citrate and magnesium glycinate are among the most absorbable forms and are often recommended for seniors with low levels. Once your body has the magnesium it needs, the difference can be remarkable. Heavy, tired legs feel lighter. Cramps and tightness ease up. Everyday tasks become easier. And that sluggish, low-energy feeling, it often fades. Number 3, potassium. Have you ever jumped out of bed only to be stopped by a sudden sharp cramp in your calf? If so, low potassium might be the reason. Potassium plays a major role in muscle control by keeping fluid levels balanced inside and outside your muscle cells. When those levels drop, muscles can misfire, contracting on their own, which leads to painful cramps, especially in your legs. For older adults, these cramps can become more than just an annoyance. Reduced blood flow or muscle mass can make cramping feel more intense and even disabling at times. But the effects of low potassium don't end there. If your legs start to shake when you stand for a while, or you feel extra stiff when walking, potassium might be involved. This mineral helps nerve signals travel efficiently to your muscles. When you're low on potassium, those signals can get delayed or disrupted, making your legs feel weak, unsteady, or hard to lift. And for seniors, this kind of imbalance raises the risk of tripping or falling, which can have serious consequences. Interestingly, potassium also supports your bones, something most people don't realize. It helps reduce the acidity in your body that can slowly wear down bone density over time. So, how do you make sure you're getting enough potassium? Luckily, it's easy to find in everyday foods. While bananas are often the first food people think of, they're just the tip of the iceberg. Foods like sweet potatoes, spinach, beans, avocados, and oranges are all rich in potassium. Even something as simple as a baked potato with the skin on contains more potassium than a banana. What about supplements? While they exist, potassium supplements should be used cautiously and usually only under medical guidance, especially for people dealing with conditions like kidney disease or those taking medications for high blood pressure. So how much potassium do adults need? The general recommendation is around 2,600 milligrams per day for women and 3,400 milligrams for men. In most cases, this amount can be met with a balanced diet full of fruits, vegetables, legumes, and whole foods. If you're concerned about your potassium levels or experiencing frequent cramps or weakness, a doctor can help assess whether your intake is meeting your body's needs. Number 2, vitamin K. It might not be the first nutrient you think of when it comes to bone strength, but it's one of the most important. While calcium and vitamin D usually get all the attention for supporting strong bones, they can't do their job effectively without the help of vitamin K. Think of it as the guide that tells calcium exactly where to go. Without enough vitamin K, calcium can build up in the wrong places, like arteries or soft tissues, instead of being delivered into your bones where it's needed. This misplacement can lead to stiff joints, poor circulation, and even raise your risk for heart issues. But with sufficient vitamin K, calcium is properly absorbed into the bone matrix, helping to keep your legs strong, stable, and flexible. As we age, this becomes especially important. Research shows that older adults who get enough vitamin K tend to have greater bone density, fewer fractures, and better mobility. That's because vitamin K activates a key protein called osteocalcin, which helps bind calcium to your bones, increasing their strength and resilience over time. But there's more to vitamin K than just bone health. Healthy legs require more than dense bones. They also depend on smooth, pain-free joints and reliable muscle function. Vitamin K has anti-inflammatory benefits that help protect your joints, especially the knees. If you often feel stiffness after sitting or experience aching joints during movement, a lack of vitamin K might be contributing. Joint discomfort is one thing, but what about muscle weakness and loss of coordination? Emerging studies have found that vitamin K also supports muscle control. It helps regulate calcium within muscle cells, ensuring your muscles contract properly and stay responsive. Without enough of it, balance can suffer, and your legs may feel unstable, increasing the chances of falls, something no one wants to deal with as they get older. So where can you find this powerhouse nutrient? There are two primary forms, vitamin K1, mostly found in plants, and vitamin K2, which is more abundant in certain animal-based and fermented foods. For K1, leafy greens are your best bet. Think kale, spinach, Swiss chard, collard greens, and Brussels sprouts. These vegetables pack a serious punch of vitamin K and are easy to add to your daily meals. K2, on the other hand, comes from foods like natto, a traditional fermented soybean dish, aged cheeses, egg yolks, and organ meats like liver. K2 stays in your system longer and plays an even stronger role in directing calcium to your bones, making it especially valuable for long-term bone support. The easiest way to boost your vitamin K? Add more greens to your plate and include fermented foods when possible. Toss spinach into your smoothies, enjoy a kale salad, or have sautéed chard as a side dish. Small daily habits can have a big impact over time. If you're taking blood-thinning medications like warfarin, increasing your vitamin K intake could interfere with how those drugs work. Since vitamin K affects blood clotting, it's crucial to speak with your doctor before making any big changes to your diet or starting supplements. For those with absorption issues, such as people with digestive conditions or those on long-term antibiotics, supplements might be necessary, but they should be used under medical supervision. Number 1. Vitamin B6. Also known as pyridoxine, this vitamin is far more important to leg strength and mobility than most people realize. While many nutrients support movement, vitamin B6 is critical for 3 things: keeping your nerves healthy, helping muscles repair themselves, and allowing your body to properly use protein to build and maintain muscle. Without enough B6, even well-developed muscles can lose strength over time, making routine tasks like walking upstairs or rising from a chair feel unexpectedly tiring. One of the lesser-known but vital roles of vitamin B6 is its involvement in nerve communication. It helps your nervous system send signals efficiently. When your levels dip too low, these signals may slow down or become scrambled, leading to symptoms like tingling, numbness, or shaky coordination. Many older adults think these sensations are just part of aging or muscle loss, when in fact, it might be their nerves struggling due to a B6 shortage. Another major function of B6 is in managing inflammation-related muscle fatigue. This vitamin helps control your body's inflammatory response, which reduces muscle soreness and improves recovery time. If your legs often feel tight, sore, or take too long to bounce back after activity, B6 could be a game changer. That's not all. B6 also plays a vital role in producing red blood cells, which are responsible for delivering oxygen throughout the body. Oxygen is essential for muscle stamina and energy. When B6 is lacking, red blood cell production can drop, leading to fatigue, sluggishness, and that heavy leg feeling, even after light physical activity like a short walk. So, where can you get more of this essential vitamin? Chicken, fish, like tuna and salmon, bananas, chickpeas, potatoes, and fortified cereals all contain high amounts of B6. By working these foods into your meals regularly, you can naturally support your muscles, nerves, and energy levels. For some people, especially those with digestive challenges or poor absorption, getting enough B6 from diet alone may be difficult. In those cases, supplements can help. But remember, while B6 is generally safe when consumed from food, taking very high doses over a long period through supplements can potentially damage nerves. So, if you're considering supplementation, stick with the recommended amounts and check with your doctor. Most older adults need around 1.5 milligallons of B6 per day for women and 1.7 milligallons for men. Hitting that target through a balanced diet is usually enough to keep things running smoothly. If this video helped you, don't forget to give it a thumbs up. It really supports the channel. Drop a comment below to share your thoughts, ask a question, or suggest a topic you'd like us to cover next. We love hearing from you. And of course, make sure to hit that subscribe button and turn on the notification bell so you'll never miss a health tip from Senior Health Tip Today.